The COVID-19 pandemic ended nearly 3 years ago, but the virus is still a major public health concern. Recent studies estimate that there were nearly 380,000 to 540,000 COVID-19 related hospitalizations during the 2024 to 2025 season, and up to 63,000 deaths. Another pressing concern for patients previously infected with the virus is long COVID. But what is it? Long COVID, or post-acute sequelae of SARS-CoV-2 infection, is characterized by the National Academies of Sciences, Engineering, and Medicine as prolonged COVID or respiratory-related symptoms. Now, health organizations like the CDC and the National Institute for Health have posted descriptions of long COVID, but no formal definition, unlike the Office of the Assistant Secretary of Health and the World Health Organization, which do. But their definitions vary in the duration of symptoms persisting after a confirmed infection. So, in order to find out more about long COVID, I spoke with Dr. Noah Greenspan, a specialist in cardiovascular and pulmonary physical therapy and owner and founder of Pulmonary Wellness Complex PT. Now, different organizations define long COVID differently, but from your perspective, what symptoms do you most consistently see in patients, and how do those symptoms affect their daily lives?
So, the definition is, it's a long, to me, it's a long definition because nothing with COVID is simple, right? It's like you have to kind of explain it. And unless you know somebody who's either had it themselves or you've had it yourself, or you've treated a lot of patients who've had long COVID, it's really hard to get the idea of what it is. And part of the reason for that is a lot of people don't know about it. Even a lot of doctors don't know about it, right? So with COVID, it's like there's no glossing over, at least in my practice, there's no glossing over any of the details. It's really like you have to go from A to Z, letter by letter, and you have to go from one to infinity, number by number, to really make sure you clearly understand the patient's condition and what are we going to be able to do, if anything, to help them.
Although there are varying formal definitions and descriptions, researchers have found five consistent symptoms across the majority of definitions. These include patients feeling more tired than usual, pain or tightness in the chest, diarrhea, decreased smell or change in smell, and fatigue, tiredness, or exhaustion. The varying definitions can also make it harder to diagnose long COVID. Other experts have said that varying definitions can lead to over or underdiagnosis of long COVID patients.
My name is Alex Blanco. I live in Long Island, married with 3 children.
But can you describe what daily life was like for you after COVID and how that changed since starting therapy?
It's been 5 years. Shortness of breath, inability to focus, extreme fatigue with very minor activity, shortness of breath. I still have palpitations. In fact, I had another follow-up heart procedure last year.
Now, after diagnosis, treatment is the next logical step. But how do you treat long COVID?
First and foremost, we have to stop people from doing the things that they may not even know are causing themselves harm, right? Like at the beginning, especially, a lot of people were told, oh, you know what? Try to do as much as you can. And, or somebody would be able to do like 1 minute of exercise or 2 minutes of exercise or 3 minutes of exercise. But if they do like 3.5 minutes of exercise, it's like cutoff switch. And now they're knocked out. Not only do they have to stop, but they're now getting a flare of their symptoms, or a worsening of their symptoms, or a relapse of their symptoms. And now, I've seen people knocked out for weeks after just overdoing it one time. A common story that I'd hear a lot of times is like people would say like, I was doing so well. And I'll be like, and what'd you do? And they'll be like, well, I was feeling so good. I decided to do a 3-mile hike up a mountain, and it's like, so first and foremost is stop the leak, okay? And then it's teaching people, what things are going to be restorative and replenishing versus what's going to be depleting, okay? And a lot of times we don't know what those things are until we try it out. And a lot of things that could potentially be restorative in a healthy person, like exercise, might be depleting in somebody with long COVID. So the first order of business is I want to do everything possible to stop inflammation. And so what are the keys to that? Number one, rest. Okay. And it doesn't mean, doesn't mean just sit and do nothing. Sometimes it does. Okay. It depends on the person and what stage they are and what their symptoms are. But first order of business is don't overdo it.
Now, there's no single cure for long COVID, but there are often overlapping symptoms with other respiratory diseases like COPD, influenza, pulmonary fibrosis, and asthma. And patients with any of these conditions can experience shortness of breath, cough, or fatigue, making long COVID difficult to diagnose. So the question remains, how do you approach treatment in a condition that can look so different from patient to patient, and how does this treatment vary from other respiratory diseases and conditions?
Let's say someone with COPD, right? COPD, emphysema, chronic bronchitis. This is what we call obstructive pulmonary disease, right? Which means when you have an obstructive disease, you have difficulty blowing air out. No problem breathing air in, but trouble blowing air out. Pulmonary fibrosis is a restrictive pulmonary disease, or what's called an interstitial lung disease, where you have trouble breathing in, but no trouble breathing out, right? So it's hard to inflate the lungs. In one, it's hard to deflate. In one, it's hard to inflate. Very often in patients with long COVID, especially because so many of them are younger, fitter, athletic, etc., their pulmonary function is 100% normal, right? They're not short of breath because their lung function is altered. They're short of breath for another reason. Or, like a cardiac patient, who has angina, chest pain, right? Like there are ways that we can work around that, either through medicine or working, giving supplemental oxygen or, changing the order in which we do the exercise. But if somebody's having chest pain that's not coming from their heart, right? Like cardiac workup is normal. So like EKG is normal. Echocardiogram is normal. Stress test is relatively normal, right? So in a situation like that, we have to work around it, right? Because again, there's no particular supplement per se, except for oxygen. And when I say except for oxygen, oxygen's huge. Like oxygen is a massive game changer, and it doesn't have to be hyperbaric oxygen.
I also spoke with someone from Dr. Greenspan's staff on some of the challenges they see when working with long COVID patients.
My name is Wei Chin. I'm an exercise physiologist, also the program manager at Pulmonary Wellness.
From your perspective, what's the biggest challenge or biggest change you see in patients from their first visit to weeks later into therapy?
With patients with long COVID, it varies a lot. So that's one of the challenges, and also something that we see all the time. Some patients respond to the therapy a lot, but sometimes patients don't respond at all. And sometimes we have to go day by day just to see how they're feeling. And I could say most patients, like 90% of the patients, they're all a little different.
Of all the symptoms we discussed, they all significantly impact patients' day-to-day lives, so much in fact that numerous studies have reported high work absence rates since the end of the pandemic. Now, before the pandemic, specifically during the 2017 to 2018 influenza season, there was an average of 1.15 million monthly absences, but this average skyrocketed to 1.79 million during the pandemic, which was roughly between 2020 and 2023. In the post-pandemic period, however, the increased average wasn't nearly as drastic, but still significant at 1.29 million monthly absences. Now, these absences are not all related to COVID-19, but categorized as any health-related absence. However, when analyzed alongside COVID-19 trends, experts suggest it could have influenced the spike of absences. Since then, and more specifically in 2024, there were 1.7 million average health related absences per month. Now, although absences declined in 2024, they remain elevated compared with long term historical baselines, suggesting continued impact.
And I have not been able to return to work still. When I first met Dr. Noah, I was in pretty bad shape. I was always a person that was, very active and very good at my job. And when COVID hit, I got very, very sick. My first exposure to COVID damaged my heart and caused me to have open heart surgery, where my heart was actually stopped for 4.5 hours while they did the repair. And then I got the Delta variant in the ICU, which is hard to believe, but that really, I think, is what caused the long term damage.
Anyone who has had COVID-19 is acceptable to long COVID, but there are more specific patient characteristics that may put them at a higher risk. For example, women, older adults, and patients who smoke, are overweight or obese, or have pre-existing chronic health conditions are all more susceptible to developing long COVID.
And what we started to notice was over time, we were seeing younger and younger patients and healthy patients, and not just healthy patients, but strong patients and super fit patients. So we started to say, you know what, this is not the typical, right? Like these aren't the patients that everybody warned us about, like the older patient with multiple medical conditions or, heart disease, lung disease, other comorbidities. It was like the athletes. It was like the people who were super fit, super active, people in active jobs, firefighters, EMTs, things like that. And so we thought like clearly there's something going on here that is not the usual pathway. We know that inflammation plays a massive role in COVID, right? And we know that inflammation plays a big role in long COVID. So when you think about people who have these, who are super healthy, who are super fit, who have these, nervous systems and who have these immune systems that are so tuned up, and then for whatever reason they're scorched, and it's almost like autoimmune in that they turn against themselves, right? So this, in my opinion, is at least part of the reason why younger people, have this big thing where someone's used to being healthy, and then we get this novel coronavirus, and the body's like, whoa, what the heck is this? And it's like, we better take precautions in our usual healthy way, and let's throw out all the stops, except that eventually, like many protective mechanisms, when they go on, when they become askew, or when they go awry, it becomes a problem.
What emotional or psychological impact are you seeing in patients with long COVID?
Again, it varies from patient to patient, but it's extremely stressful. I mean, when you can't breathe, extremely stressful. When you can't walk without getting chest pain, extremely stressful. When you can't work, when you can't take care of your family, when you know, I mean, for so many people, life has been turned on its head. And so there's going to be aspects of anxiety. There's going to be aspects of panic. There's going to be aspects of depression. Now, to be clear, that's not the cause of this, okay? And oftentimes people are dismissed, or things are attributed to depression or anxiety or panic that aren't. It's normal to panic. It's normal to be anxious. It's normal for your heart rate and blood pressure to go up. It's normal for you to panic. If you are, short of breath, you can't breathe, it's normal for that to be anxiety provoking.
What Dr. Greenspan describes reflects a broader challenge in long COVID care. Recovery isn't just medical, it's environmental and psychological. Access to clean air, the ability to work remotely, commute demands, and stress levels, all of these factors influence how patients experience symptoms and how quickly they can improve. That's why individualized treatment and consistent follow up can make such a significant difference.
I still struggle, but after COVID, I mean, I spent a lot of time in bed. I just couldn't even have the strength to get out of bed, and was very dependent on my wife and children to help me. There's also a mental aspect that comes with it, anxiety, depression. But it was very tough just physically not to be able to do things. It's not just a lung condition. It affects, I think, every part of your body.
Stories like Alex's are not uncommon. Many people around the country have similar experiences, but Dr. Greenspan pointed out that having a quality healthcare practitioner and team can make all the difference. What's the most important thing you want patients to take away and remember when they're going through therapy for long COVID?
Saying that things can always be worse is not a comfort to somebody, right? But I would say this, I would say we all have a range, right? And if we do all the things right and we get lucky, we'll be at the top of our range. If we do everything wrong and we get unlucky or we get unlucky, then we'll be at the bottom of our range, right? So my biggest issue is number one, prevention. So if you're in a scenario where there's going to be a lot of people around, where people are sick, where you're a high risk patient, where you're taking medications that may, lower your immunity or suppress your immune system, then you have to be extra careful, and you may have to say no to certain engagements or to certain offers that you get, like going to the Met in the middle of cold and flu season, something like that. So prevention is the key. If you are going to go to situations like this, by all means, wear a mask and wear a good mask.
Recovery from long COVID isn't linear. Some days are better than others, but as Dr. Greenspan emphasized, progress, regardless of how small, matters. For many patients, simply having validation, structure, and support can be just as important as the physical rehabilitation itself. Long COVID continues to challenge patients, clinicians, and researchers alike, but as we've seen today, rehabilitation, individualized care, and ongoing prevention strategies can help patients move forward one breath at a time. Now, if you found this video helpful, make sure to like and subscribe for more in-depth healthcare insights. And for continued coverage on COVID-19 and long COVID research, public health policy, and emerging treatments, visit ajmc.com. We'll continue covering the science and the stories behind long COVID, so stay tuned.